Hi folks, I've got another exercise video for you today. This one is for a patient of mine dealing with knee pain, in fact bilateral knee pain. So this video is sort of a starter package of exercises to kind of begin the active rehab component of dealing with knee pain. We're going to be doing some treatment as well, including laser therapy, soft tissue care, joint mobilizations, and of course reviewing the exercises. But on her own, she's going to be working on these exercises, and I'll chip in when I see her to make sure that technique is good. So let's get started. We're going to do a combination of strength training and stretching for hip and knee related musculature. So for strength, I've asked her to begin with strengthening the gluteus maximus and the gluteus medius and minimus, basically the side of the hip and the back of the hip. So to get started, we're going to do what we call the glute bridge. So for the glute bridge, we are lying on our back with our hips and knees bent, heels a little bit close to the bum. You can put your hands on the floor. And what we're going to basically do is bridge up with the gluteus maximus here, and then slowly bring it back down and back up. When you get to the top, you want to really squeeze and make sure that you really use those glutes. And on your way down, you can even start to feel each vertebrae touch the ground one at a time until the back is flat and straight back up. So that's the glute bridge. Now, to strengthen more of the side of the hip or the other glute muscles, we're going to lie on the side. I'm going to put my trusty foam roller here as a headrest. Now here I've given her two options to strengthen the lateral hip muscles. The first option is what we call the lateral straight leg raise. So straight up, not too high that you're using more of your sort of rib cage and low back muscles, just high enough that you're using those hip muscles. And again, it's a nice slow control up and slow descent back down. Now, option two is commonly known as the clam shell. It's called a clam shell because your legs are going to be mimicking the opening of a clam shell. So here the ankles are together, the knees are together, the hips are stacked, and we are just lifting one knee away from the other, and again, slowly back down, and you're going to feel that in your side of your hip here. Notice I'm not rolling away and the rest of my body getting involved. This exercise is just about these muscles here, so you will know when you reach your end range. So those are three strengthening exercises for the glutes. And then we're also going to move into strengthening a bit of the quads. You get a little bit of glute action here using a squat pattern. Now there's lots of options for the squat. One option is, especially if you've never done squats before, you might want to start actually leaning against the wall, getting your feet around a hip width apart, your back is flat against the wall. And what you're doing is you're just sliding down the wall. You can hold there, feel sort of the burn in those muscles, and then come on up. Or you can just go up and down. Now, if you don't like sort of leaning right against the wall, and you have something like a foam roller, you can actually put that against the wall, lean against that, and now you've got something that will actually roll with you. Might make it a little bit easier to do squats like that. And when you're feeling ready, and we will discuss this in person at an individual level, but when we're starting to get ready, we can start to move away from the wall and practicing just sort of freestanding squats. Sort of call these sort of more like mini squats. And then of course, as we get really great at squats, we might be able to go further and further into that range of motion. But for now, just starting with some easy squats like that to build strength in the relevant musculature that is going to influence knee pain. Okay. So after we strengthen, we stretch. So let's go through some stretches if we're dealing with knee pain. We're going to want to stretch our quadriceps, our hip flexor, and our hamstrings, and our glutes. So let's get down on the mat and let's stretch glutes. Single knee to chest stretch. Hold for a minimum of 30 seconds. Could be upwards of 2 minutes. Switch and do the other side. As you'll see from other videos I make, we often do both knees at the same time as well. Holding each of these for 30 seconds. And we can do the figure 4 Piriformis stretch. And the other side. Notice I'm reaching through here to grab my leg here. If you can't reach your leg, you can just grab onto your thigh. And alternatively, a lot of people have trouble reaching through like that. Getting yourself a handy yoga strap would be valuable. So for example, I could loop that around, lie back. Now I don't have to reach for anything. I'm just giving a pull on the yoga strap. This yoga strap will come in handy to stretch the quadriceps as well, because again, here's one way to stretch the quadriceps is you kick back and grab your ankle and get a good stretch in the front of your thigh here. But reaching back and grabbing your ankle can be difficult for many. So to get started, a good yoga strap comes in handy. You loop that around your foot. You get that around your shoulder. And now you can just use the strap and keep tugging a little bit more until you get that good stretch in the front of your thigh. So we've done some glute stretches, some hip rotation stretches, a quadricep stretch. Now we're going to get into hamstring. Lots of different ways to stretch the hamstring as well. Commonly you'll see people do a just standing toe touch. Some people will kick the leg out front and then hip hinge over that leg. You can feel that in the back of my hamstring here. And alternatively is just simple sit and reach. Sitting, back supported or not, and just simply walking your hands towards your ankles. You can grab on and feel that stretch in the backs of your thighs here. Now, keep in mind, hamstrings and almost all muscles aren't just a singular line. They run in different angles. So you could open the legs, reach one direction, stretch, reach the other leg and stretch. You can even sort of rotate the hips. You get a slightly different angle into those hamstrings. So that's hamstring stretch. We've done quads, we've done glutes, we've done hip rotation. Another relevant muscle for knee pain is the back of the calf. So a good way to stretch the back of the calf is you can grab yourself some wall. So if I'm stretching my right leg here, that's going to kick back here with the heel down. And if I keep my knee straight, I'm going to feel that right in the back of my calf here. And again, I'm going to hold that for about 30 seconds and get a nice stretch. So a little bit of strengthening, a little bit of stretching is a great way to get started with the complement to the treatment phase of treating knee pain. All of these exercises are going to progress. We're going to do more repetitions, more sets, make them more complicated, and add more movement and strength training approaches as we progress through our knee rehabilitation and hopefully leave knee pain in the past. If you have any questions, don't hesitate to reach out. Contact me by email, give me a call, make an appointment, and we'll tailor a exercise plan to match your treatment to get you feeling better. Thanks a lot.